All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We're doing our acne scar combination today. First with TCA Cross, now with our deep laser going into our superficial laser. This is our CO2, a deep FX. This is one of the most deep and powerful lasers on the market for acne scars. We are doing a really high density for deep, but overall a small density for CO2 because we're going to be going more aggressive with our active laser when we get to the next step. You guys could see with the deep laser, it's very fine point. Look up close right here. Very fine point dots, very little dots because the density is really low and the beams are very, very narrow, but it allows you to go really deep without harming the skin. The good thing about the deep is you don't feel as much pain as the active. So we're gonna read them.
We have some other doctors saying hi to you on here.
Hey guys, where are you calling from? So this is really going to help him long term. I want to do some fillers into these scars as well and continue the remodeling with more lasers. Come from the side.
So what are you doing?
Tell him.
Guys, we're using our deep FX laser right now. We're going to give our patient the total FX treatment. We use the deep and the active. He's had some traumatic acne scars right now, so we're going to give him a full resurfacing, all at different depths because acne scars are not just at one depth.
Exactly. And luckily these types of scars actually do really well with laser.
Those are more broad, like bed scars.
Exactly. These are more broad, thinner scars, so filler and laser are the best choice. All right, so I'm going to take a look.
So this is CO2 better than Halo. The completely different lasers.
Yeah,
completely different lasers. One's a hybrid laser with an erbium component, and this one is a CO2.
And sometimes we do them together. Okay, so that's perfect. So that's a deep. We're going to switch now.
Someone said, hi, Dr. Jason. You have a lot of followers from my country, Brazil. Is that numbing cream on the face? Yes, it is, guys. We're numbing before we do the other side.
So we're going to switch. Let's go. Switch.
Alright guys, see our patient is protected right now. We have our great eyepieces from Innovative Optics.
So I'm going to get some more while they're switching to the active. I'm going to add a little more numbing to these other areas here, and you guys can ask me any questions. Now, we prepare the skin with skincare from Cosmetics.com.
Can you tell them about our mask that we have here that we're going to use afterwards?
Let's do that when we get. Well, give it to me. You gotta give it to me then.
Right there.
All right. So show the mask.
Right
so that is our intense hydration mask from Emer Skin. That's our new line. That's gonna be launching very soon. Already super popular. You can keep it in there. It has hyaluronic acid, peppermint, green tea, botanical extracts, and peptides, all to help the skin heal. And that's what he's going to use afterwards, and we're going to put on immediately.
You have a lot of doctors asking questions on here. It looks like asking about depths, about erbium versus CO2. You guys send us a DM. We'll help you get training from Dr. Emer. He does offer training at all of our locations.
We could do training. Perfect. So we're getting.
So that's what depth? No, not going to tell you. Trust the process. Team Dr. Emer is professional. I'm so happy to make a good choice to get my treatment with him.
Who's that? Thank you. Make sure you write a review on Yelp, Real Self, and Google.
I know who it is. She has really good results.
Oh my God, amazing. Okay. So let's get that going.
What did he get done? We are doing a laser treatment, guys, for his acne scars. I was informed that erbium works better than CO2 on ice pick scars. Is that true?
That is not true at all.
TCA Cross.
That is unfortunately not true. Okay, so he will feel this a little bit.
Some more superficial laser than we just did. You guys will see the skin's going to appear to look more burned.
So you can take a look up close, turn left. He's swollen.
how long is prep? We do prep with Cosmon peel,
2 weeks.
light and exfoliation peel for 2 weeks prior. Should we think that you need it for your pigmentation? Someone said I have
All right, we're gonna
hyperpigmentation.
start, so you're
I have
gonna feel this.
hyperpigmentation. Was the
Turn
best
the
way to remove it? You guys are most likely going to need skincare. We can do lasers as well. You need to send us a DM, full name, email, and phone number.
Look at the active. You guys could see how superficial and tight this is. And look at the density there.
For ice pick
So
scars,
we're
do you
gonna
use
start- you're gonna feel
TCA
this a
Cross?
little bit.
Yes, guys, we use TCA Cross in a lot of our combination treatments.
You guys see we're going right over the area we did the deep. Okay. He will feel this in some areas and less in others, so I'm doing the areas that he's gonna feel a little bit more. That's why we have numbing still in the other locations. He's doing great. And this is a high density superficial, so this is 1.2 millimeters in spot size.
When are you coming down to Florida again? I need an
October.
appointment, guys. We'll be there in October. We'll be there on the 20th.
Hurry, because we're almost booked. I
We're
think
almost
we are
booked. We have a newer location there. You guys send us a DM, full name, email, and phone number. We'll still be in Boca Raton.
So you guys see, look at, we're going
Spanish?
really superficially.
When is he in New York City, guys? We'll be leaving next week. We'll be there on Thursday.
So make sure you get that appointment
There's
right
only
away.
a couple slots left, if that.
I don't
We
e-
can
I
try to
don't-
make some things work. Send us a DM.
You're doing great. Halfway done on this side. He's really motivated to get a great outcome. Traveled in. We're getting him the best results. Both deep and active. You guys could see really high density. How do you know it's high density? Because the fractionation, the spaces in between each of the lasers is minimal. This is really high. But he's doing really good. Especially for a guy. Most guys, terrible. Crybabies. He's got thumbs up. Got
Especially the ones in
surfer hands.
California.
Exactly. The ones from California are more likely, have more pain? Which one, Jordan?
I think the ones in California have more pain.
Maybe. It's probably true.
I think it is.
So you guys see he's doing really well. We're almost done on this side. We renumb in between so that the channels that were created in the other laser pass allow the numbing to go through. This area we didn't renumb because we do it right away, but the other ones will be better, a little bit better for him.
Can we do a skincare consult? Yes, we can, guys. Go to the link in our bio, Emerage Cosmetics. You guys can get a virtual consultation on there. The cost of your virtual is applied to your skincare.
And we can
We need you in
send
Brazil.
you products.
So let's say we need you in Brazil, guys. Come fly to see us. We can send you skincare in Brazil, by the way.
You can, and send you skincare and peels. Okay, let's wipe off the other side. I'm gonna get that wiped off. See how you are? I'm just gonna fine tune a little closer to the eye. We're using our innovative optic goggles, you guys, so he's very well protected.
He said he is the laser king.
What's that?
Someone said you are the laser king.
Thank you.
Someone's waiting for you in Dubai.
Cannot wait. We're gonna be there in 2 weeks. We will see you. Make sure to contact Tajmil. We will see you there. Okay. Let's start on the chin. I'm gonna get him really wiped off. This has got a beard. It's doing really well. Amazing, actually. Turn all the way right now for me. There you go. Now we're going to continue to the other side. So this is different tolerance levels. Some people want to be asleep for this. Some people can do the nerve blocks and the topicals. We did topicals. We could do pills. No, yeah, that's fine.
Will there be any remaining acne scars post?
Yes.
Guys, there will be. It's a percentage improvement. It's not a total improvement in one treatment, guys. Acne scars is usually a treatment plan.
I wish I
Guys,
could.
it's not a one and done. When it is there, we will do that. Is this good for melasma?
No, this is
No,
actually
this is not.
really bad for melasma.
Someone said, are you really coming to Dubai? I can't wait. Yes, guys, we have a promo pinned on our profile. Check it out. We will be there.
Yeah, please make your appointment now. We're almost booked, actually. I got a thing today. And you guys can see there's a little bit of oozing through here. That's from the deep laser. I call that dewdrop on a rose petal. It's like little water droplets you see coming through the skin right on here in this area, because that's where the deep laser is. Why is that happening? Because there's a lot of swelling that's going underneath the skin from that deep laser.
So you have CO2 laser for his full face. Yes, guys, we're doing full face. As you guys see, we just did one side. We're doing
Almost
the
there.
finishing the other right
Doing
now.
great.
Then we're
We're
gonna
very
hit the
close.
forehead next.
So make sure you guys go to emercosmetics.com. We have an ablative laser package there that I customized for people using my peptides from Emer Skin, anti-age stem cells, and other active ingredients in some of my favorite product lines, just because it helps healing. In the old days, we used to use Vaseline and other things like that. It was just terrible. People would not heal well.
Occlusives are not what you want to use for CO2 lasers.
No. So this is what I call a feathering pass, angled pass,
Side fire.
side firing here. Almost done.
Do you guys speak Spanish? Yes, we have people here who do speak Spanish.
But no, don't move your head. Perfect. All right, let's get that wiped off. We're gonna wipe off and finish on his forehead. We're almost done.
All right,
Next
guys.
part is the forehead the easiest. This is the most known.
Between the eyebrows, too.
Is this for laser hair
you're
removal?
gonna get
No.
everything.
No, we're not doing laser hair removal, but we do offer that here.
We're getting it. We're getting them all wiped off. I did the deep laser on the middle part of his forehead just to get that deep wrinkle and some of the textural irregularities. Gotta wipe them all off. All over. A little bit more. Good. All right, turn all the way right for now. There you go. Stay right there.
Wait, is he
We're gonna go to
Spanish?
the temple, and we're gonna move our way up to the forehead.
What are they saying right here? Is that in Miami? What does that say?
Consultation, you guys.
Tell them to send a DM, full name, email, phone number. And tell them
Sí, aquí tenemos vivo en Miami. Quiero consulta con ustedes. Si quiere una consulta, no se le olvide mensajearnos con su información para una consulta.
What was said?
someone in Miami wants treatment.
Perfect. Let's do it. Let's do the virtual consult. Tell them to do the virtual consultation now because we need to send them the skincare.
Va a ser una consulta virtual
Try not to
si
move.
quiere una consulta con nosotros allá en Miami. No se les olvide.
Almost
This one,
done.
they're coming in now.
What?
Let's see.
Eso duele. No, no duele. Ahorita tiene él una anestesia de que no siente absolutamente nada. O si siente es poco.
What does that say?
Yo lo, she did it, but they called her in English.
The what?
Tell her to call back. Tell her to call back. We'll speak Spanish.
Sí,
Or
so
send
yo
her
no
information.
hizo una llamada, pero sabe que si hace una llamada otra vez, no se le olvide agarrar en español. Lo hacemos también en español.
was saying he's the only doctor that actually shows the process and so much education.
Thank you. My patients allow it, which is amazing, and that's the thing. Very lucky, because when we first started doing this, it was all about results. That's what we want. We want to see results in the reality. We had a girl cry, actually, a couple weeks ago during treatment. She had a lot of pain. I think it was important for people to see, but turned out she got an amazing outcome and was super happy. So sometimes, you know, it just is what it is. He's doing great. There is a level of pain.
When can I have a consultation?
Anytime they need to reach out, send a DM, full name, email, phone number.
Sí, ¿cuándo puede tener la consulta? Cuando usted quiera.
Almost
Mande
there.
su información y podemos agarrarle con la consulta
Stay
rápido.
right there. Almost done, you guys.
Just thank you.
I'm gonna write them right now. Thank you.
Yeah, that's good.
We're doing a little hairline feathering.
Where are you from, guys? We are based in West Hollywood, California, but we go to Boca Raton, Florida, New York City, and Dubai.
Now we're gonna finish his nose.
Is this worse than your sport?
Then who?
Do you wrestle?
Wrestling? No, MMA? This is different. This is more torture. MMA is quick pain. No, she was asking if MMA was equally as painful. I think it's different pain.
So like with that much adrenaline, you can't feel anything.
You're gonna best
Is
look
he
your
getting
skin.
Bellafill for his scars as well?
Not today.
Not today, but we are going to do it.
Long term, it's a part of the plan. Or sculpting. Or both.
Butera's on here talking about CO2.
Who?
Butera.
I'm saying what?
It's
Great.
CO2.
We love CO2. Alright, basically done. Just gonna feather the edges here. Just make sure it's really even.
What will be his downtime?
So, about 5 to 7 days. 5 to 7 days of peeling. Let's get the PRP in the mask.
I'm a bit cold.
Cold? We'll turn off the air. We can turn off the air. Alright, we're gonna put the PRP on you. Hold on. Do the mask.
Here, give him the mask.
Botanical mask. So now we're gonna use the Emer skin mask, you guys. And again, I made this. You can get it at emeragecosmetics.com. Providers, you can have this for your office. We made this on purpose to hydrate and help the skin heal. So there's a lot of extra serum in here. I'm gonna pour on him. It's gonna cool him down. So we're gonna get a little bit on here. So make sure you're wiping that. Wipe all that. Wipe all that. It's gonna get in his mouth a little bit. So wipe that off. So we made this on purpose. Gauze for his mouth. We made this on purpose to get really oozy. We want this to get on his skin immediately. Peptides, tea tree, hyaluronic acid, vitamin C, everything you need immediately afterwards. And you can take some extra of the serum home. Watch his eyes, wipe his eyes. Go ahead. You can take some of the serum home and you can put some on later tonight. We also applied his PRP to help him heal more quickly. There we go. Now we're gonna give him the cold air. All right, perfect. So now he is healed. He's gonna take home the intense hydration mask. He's got the cold air, even though I know he's cold already, we still need to get his face cold. And that's a wrap. for our acne scar combination of TCA and CO2. Stay tuned for the testimonial with him, and we'll also do follow-ups over the next couple weeks. It's going to be a really big result. All right, you okay?